So I'm Kate Labiner. I'm a pediatric neurologist from Austin, Texas, and this is my third or fourth year coming to Epilepsy Awareness Day at Disneyland. And I appreciate you guys coming. We are going to talk today briefly about Libervant, which is a new medication. The agenda for today is going to be a short intro into Aquestive Therapeutics, which is the company that makes it, and really talking at the unmet need in patients with epilepsy age 2 to 5 years of age. So for those of you who care for these patients or may see these patients in the real world, when we talk about emergency medications for seizure cessation, this is what we're talking about. We talk about weight. Everything in epilepsy goes by weight. How big is the kid? And then it's always how many milligrams per kilo, and what do you, in terms of how much you're getting, whether it be your maintenance medication, whether it be your emergency medications. And so when we talk about that, that becomes very important because a lot of those little kids don't meet the weight criteria for other meds, or we are worried to give them because of the dosing. And so we'll talk about that a little bit later. We'll talk about the standard of care in terms of emergency medications as it stands right now, and then Libervant, and we'll talk about kind of why it's new and different. And then we'll take questions. So Aquestive Therapeutics is a pharmaceutical company that is advancing medicines to bring meaningful improvement to patient lives through innovative science and delivery technologies. And so while that sounds lots of words, basically it's looking at where is an unmet need and how can we better serve patients to help in that standpoint. It's focusing on overcoming barriers that patients face with existing treatment options. And they are currently the worldwide leader in delivering trusted medicines via an oral film, which we'll talk about how that works, with 2 billion doses consumed over the course of 18 years with a variety of different medications. So the core technology is what's called a pharma film. When parents ask me, what is this like? I tell them it is a Listerine strip with your kid's meds on it. And I think if we see it as that, it helps to visualize what we're talking about. And if you're interested, we actually have some samples. I think, Brian, you have some samples that don't have meds in them. So sorry, no, you don't get benzos for free. But you can see what it's like, which I do think is helpful. And I will say in our clinic especially, that's something that families really like because, of course, we don't want you taking your child's meds to see what it's like. But this way you can get a kind of sense of what it is. It is convenient, it's incredibly small, so there's no device for this one. So unlike some of the others, right, we don't have, you may have seen like Diastat, which is kind of the standard, has been around for a very long time. That's a rectal gel. That one obviously has a whole device that it comes with. It's also no needles and it's oral. So what happens for our refractory seizures, this is defined as 2 or more AED regimens, so that may be any medications. And you'll hear either that you failed or you're currently on more than one, and you may or may not be getting seizure freedom at that point. And so that's the definition in epilepsy for refractory epilepsy. This obviously leads to lots of comorbid issues. Psychiatric being kind of number one. Epilepsy in itself is a very anxiety-producing condition, especially for people who are out in the workplace or kids at school, right? Parents too. No parent wants to be out somewhere and have their kid have a seizure and feel like there's nothing that they can do, right? And then you end up, 911 gets called, then you have to argue with EMS because you don't want to go to the hospital and they want to take you to the hospital. There's a lot that goes into this. I tell all of my patients, if they tell me they're not anxious, I kind of don't believe them because you should be, right? This is an anxiety-producing situation, not just for the kid who has it. And I say kids, I mean patient in general, just know because I'm pediatric, I see kids. But it is also for the caregivers, right? Parents are scared to send their kids to school or to let them go have a sleepover. What do you do when you're now saying, I'm going to send my kid not knowing what's going to happen out into the real world? And that's really, really anxiety-producing. About 1 million epilepsy patients suffer from uncontrolled refractory seizures, and this is the greatest risk for sudden unexpected death in epilepsy, or SUDEP, which I think there's a couple talks about SUDEP. That has long been the kind of unwritten thing that everybody kind of forgets to mention in visits because it's really scary, but it is very real and it very much exists. If we can help reduce that risk by giving people options, that's what we're looking for. Seizures account for about 1 million emergency room visits annually. That's a lot of money. And oftentimes we hear that the kids get admitted, even though we would not necessarily in neurology have wanted to admit them. But ERs are scared. They're scared to send you home. They're scared to send kids home when they don't know exactly what's going to happen or what caused it. And so then too, like I was saying, when we talk about like clusters and things like that, parents may tell EMS, no, I don't want to go to the hospital. And I can't tell you how many times I get a page saying, I need you to tell EMS I don't want to go to the hospital because I don't want to go. And we have to talk them through that, right? And that means EMS is now sitting in somebody's house for longer than they need to. So all of this is important. This is the only FDA-approved treatment for patients 2 to 5 years old. That is important outside of Diastat, because Diastat's approved for everybody. I will say, I don't think anybody in this room, if you've ever given Diastat, will know why we hate it. It is a rectal gel. That's a lot. There's a lot to unpack in Diastat. It is a 14-step administration. It comes with that on the insert. That means that when you are going through it, if you have never given it before, you are following literally 14 little boxes. That's a lot. It takes real time to do that. In terms of how much we get with any kid that I've ever given Diastat to, it's a toss-up. I don't know is the answer. It is a gel, and if you have ever given anything rectally, a lot of it comes back out, which means then we don't actually know what the dose you got was. If you can imagine, right, when we're all adults in this room, so you can imagine when you were in high school, can you imagine having a seizure in a cafeteria and having this be what all your friends got to see? Horrifically awful, right? I have kids who have told me point blank that they would rather have seizures than get Diastat, and I get that. I don't blame them. I think I would too. It's also not very portable. The box that Diastat comes in is about this big. So I don't know, for the women in the room, I like to carry a small purse when I go places, which means it would not fit in that. And so you're basically carrying around a gigantic bag just to bring the medicine with you. If you have to take it on a plane, that was a big thing when they started limiting the amount that you could take on a plane, because it just about hits that. And so these are all things that are very real for our epilepsy families. You also have to get it basically exactly perfect. So independent of getting those 14 steps right, you have to make sure that the patient is in the exact right position, but you can't lay them down, but they also can't be on their back, but they can't be like this, and then you're supposed to squeeze the butt cheeks together. And I'm not gonna lie, it's not good for anyone. Now there are people absolutely who this is their best option for one reason or another, and that's kind of my stance on all medicines, right? And that's my own kind of statement on it, is that there is a medicine that is a good fit for different people, and I absolutely have patients who that is what we prefer because of a certain situation that they're in. But I think talking about all the different options that there are only better serves patients. So what makes this different? So this is think about, right, your little Listerine strips, film, right? It is possibly the simplest thing on the planet to give, because all you have to do is open it and put it in the mouth, and that's it. It can go in the cheek, so that's what buccal means. I think there's a lot of kind of thought out there that it needs to go onto the tongue, which then of course goes against everything that every doctor has ever told you about rescue meds and epilepsy, right? Don't stick your hands in their mouth, don't do that. I think the key in this is it's really the cheek. We are talking about going here inside the cheek. Okay? If you can get it, some of the kids, or some of our older adults and older kids, can actually potentially give it to themselves too, which also makes it very good. Ryan, do you mind holding up, I'm going to reference the man in the back, do you mind holding up the example? These are the trial ones for you guys. So that's the packaging. It fits in your wallet, it fits in your purse, it fits in everything you could think of. So it is incredibly portable. It doesn't need to be protected. It's in kind of like an aluminum type film, so it doesn't need to be protected from light, which is a big thing for some of ours. It doesn't need to be kept cold. For some parents, right, they're carrying meds in a, I just forgot the word, cooler. Thank you. There we go. Oh, look, he's holding up the little strip. There you go. Like I said, you can try it. It's minty. Yeah, it's actually not bad. I tried it, it's actually really not bad. And so the shelf life is going to be 36 months, which is also longer than a majority of the liquids or the gels, right? Because they're going to denature faster than that. For families with high copays, that's also a really big deal, because spending $500 every 18 months because you have to replace it that's a lot. And then it's also precise. We know exactly how much you're getting. Even if you were to drool, remember, what do we say? Roll someone on their side, they're going to drool out this side, but luckily you have two cheeks. And so you can put it in the cheek that isn't having all of the drool, so it's not going to come out. So all of those things, I think, are the things that we think about. In terms of the precision, and this is really important when we start talking about it, how are we treating and are we doing a better job in really stopping the seizures, knowing that a majority of patients are getting 96% of what they're supposed to be getting is huge. Because we don't know, and I can tell you, having given Diastat, I don't know how much came out. It was more than I wanted. But then that way we can't tell EMS when they come or tell the ER, I don't know how much they got, right? This way you can say, I know they got 5 milligrams, I know they got 10 milligrams because we know exactly how much was given. It is mint flavored. I will say if you're awake when you can give it to yourself, that probably matters. I think for some of our kids it doesn't matter. Mint's a funny flavor, kids either like it or hate it. It is controlled release and meant to help retain in that microenvironment. So if you get it onto the cheek, it will start to dissolve and it's actually absorbing right there. You don't need any water or liquid, so unlike any of the tablets, they have clonazepam tablets that dissolve. Those do need a little bit of liquid, and so when I'm recommending for parents to, if they're using that, I actually have them like rub it on the cheeks to try to break up the tablet a little bit, and you don't have to do that with this. Again, that way we know how much you're getting and how well it dissolved. It's diffusing through the oral mucosa directly into the bloodstream. And this is big when we talk about like first pass metabolism. And so for doctors, that stuff all kind of matters, like how quickly can you get it? The faster we can get it into your bloodstream, the more accurate and the more likely it is to work. So it really is then working on refractory seizures in patients 2 to 5. Seizure emergencies can happen anywhere and without warning, right? We talked about school already. Yes? Yes, ma'am.
The film only in this medication, or they can actually put other medications into the film?
They can put other medications into the film. Yes. Yes. Currently, I don't know how many, 2?
There's a couple across multiple therapy areas. There's one currently at another company called Serdio, which we manufacture, called Ciclozan, which is a formulation of clobazam. And the company's also in the process of submitting an NDA for epinephrine as well.
Which I will tell you, as someone with a food allergy, I'm very, very excited for that, because the one thing that I get yelled at constantly by my significant other and all of my friends, including while I was on vacation with my parents and couldn't feel half of my face and was like, I'm totally fine, is because I don't carry my EpiPen because it's gigantic. And I don't have the pocket space. So much like any other emergencies, right, they can happen anywhere. It's very important for us to have something on us at any given time. You can imagine, if you have a gigantic box, it's probably not on you. And on top of that, if you're a parent or a significant other of someone with epilepsy, you have to think about, do I really want to give that in the grocery store, right? Or would I rather someone call 911? And I think that that's a very real thing for families and for the patients as well. The speed to administering it is going to also be quick. This is very important for us. We recommend using emergency medicines at the 2 to 3 minute mark in a seizure, because we know that a majority of them, if they go into that 3 to 5 minute range, the chances of them stopping on their own becomes less and less. And so that becomes very important. The faster we can get something and more accurately that we can get something to you, the better off everyone is going to be. The film will go over in just a hot second on how to use it, but because it is so small, it's literally open it, take it out, put it in the mouth. So that's a lot easier. The positioning doesn't matter. If they're sitting, great. If they're laying down, great. If you've ever tried to give any of the others, which I don't know how many of you in the room have had to give them, I'm a doctor at Epilepsy Camp, and so I have given essentially every single option that there is at this point. And there are times when someone has rolled. I'm not that big of a person, which means if it's one of my teenagers, I may have a very, very hard time rolling them onto their side, but I can usually reach their mouth. At least in some form, to get my finger into their mouths. And we have a running list at camp of all the people whose mouths my finger has been in. And it's very entertaining because it's a lot of them. For a lot of different medicines, but usually for the emergency meds. But being able to take this and have it being simple. The other thing too is that, especially in the pediatric population, we have other family members who are having to give this. And I know my grandparents would not have ever given me Diastat. They probably would have just called 911. This is a much easier thing for people to wrap their heads around giving. And I think that's very, very important. Again, portable. We showed you how small it is. You can put it into things. Doesn't need to be cold. Traveling, that's a big thing. And being able to keep it in your traveling areas, you know, like I have a like a toiletry pack that's always packed. You can leave it in there for 3 years, which is pretty impressive. So when we compare it to other things, and we're going to compare it to Diastat here. Diastat, rectal, Libervant's going to be oral. The shelf life of Diastat is 36 months. I will say we usually end up replacing it much sooner than that because it can't get hot, and I'm from Texas, and so if you've put it in your car and forgot it when you went to the park, now you can't use it anymore because we don't know if it's good anymore. And so if it gets too hot, or you left it somewhere, or it sat somewhere for too long, then we actually recommend that you replace it. The portability we talked about, steps to administer we also talked about. The difference here is the 2 to 5 versus 2 and over. So Diastat is 2 and over, but it's also, there's a small caveat to that because it's 2 if you weigh 10 kilos and over. And so that's a really big barrier for a lot of our kids, especially like my micro preemies. When they're 2, a lot of them don't weigh 10 kilos yet, or even some of our kids with the genetic conditions, they don't weigh 10 kilos at 2 years old. And so we do think about that, and if you read the kind of subtext in Diastat, it's actually, they recommend being 10 to 12 kilos before you use it, and that's for a side effect standpoint. It can be given in any position versus obviously if you're giving something rectally, they need to be laying down, it needs to be on their side as well. So if someone was to fall in a specific position, you would have to readjust them to give it. I will also say I've never successfully given Diastat on my own. It has to, you basically need a friend to help you because otherwise you need 2 hands to hold the butt cheeks closed, which means you're injecting and then holding, which means somebody also needs to be holding the patient. So this is all the safety stuff that's, a lot. There's a lot on this slide. We've essentially already talked about all of this. It is going to be a short-term treatment for seizure clusters, which are going to be the ones that come together. They're typically short, and you're going to see like one back to back to back to back. How that gets defined is a bit dependent on your family member with epilepsy, right? So for my kids, I have some that we say, okay, 3 and 10 minutes is a cluster for you, but I have another kid at maybe 3 and 2 hours. And so that part is going to be dependent on the kids themselves. We technically has not been checked, and so you will hear this party line 2 to 5. And I was reminded before I came in to say 2 to 5 repeatedly. Am I doing a good job? Thank you. All right. Like any of the benzos, we do talk about the side effects. Slowed breathing is going to be true across the board. Apnea is very, very rare, but it can happen. That's a side effect of all benzos, and so you will see that one across the board. That is something that we can see with all of them. It's less likely in certain formulations than others, but that is something that you will see as a benzo. It's very, like I said, very, very rare. The most common thing that we see with all of them is sedation, so they get sleepy. Oh, there we go. Okay, I think we can keep going with that. And so really the big thing, anytime you're making any changes to somebody's seizure medications, we want you to talk to your doctor about that, because they're going to know your very specific kind of needs based on your epilepsy, your conditions, your other medications, and that becomes really important when anytime you're making these. We don't recommend that you start or stop medication suddenly without telling your doctor, and that is true for the seizure like emergency meds as well. So definitely things for us to look at. And then we talked about some of the side effects. Sleepiness and headaches are probably the 2 most reported, and that's kind of true across the board. That's a complicated one, and I think that's true for any of the emergency rescue meds, because lots of people are sleepy and also have headaches after seizures, but that's something we kind of see in all of them, whether it be the Diastat, the nasal sprays, or then also the films. And so we hear that a lot when they get to the ER, that, oh, they have a headache, and it's like, well, yeah, they had a seizure, and so it's not a big surprise for us. All right, questions? I'm sorry, I talk really fast. Yes?
So right now, the medication is only for children ages 2 to 5?
Yes, that is the FDA approval as of right now. That's a work in progress.
But the way it's administered, the
Mhm.
film,
Yes.
is that going to be available to adults too in the future?
I believe that is the hope, yes. So there's nothing inherent about the film itself that can't be used in other age groups. So the other medicines are used in other age groups. So like the clobazam, which is the Onfi version, if you're on the pills or the liquid of Onfi, that's in the film, is used in other age groups up into adulthood. Yeah. And I actually have a couple kids who prefer it to the liquids, because they don't like the liquids but they can't swallow pills. Easy enough. All right, if you guys have any questions or anything specific that you want to ask me independently, please feel free.